Healthcare costs in the United States surpassed $2.3 trillion in 2008, more than any other country in the world. U.S. standing in international health rankings continues to decline. Within the United States, Tennessee ranks 46th in life expectancy, 44th in infant mortality, 48th in obesity, and 45th in preventable hospitalizations. In 2004, Tennesseans spent more than $32 billion on medical care. Why do we spend so much and get so little?
Major funding for NPT Reports, Children's Health Crisis, is provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Nashville Healthcare Council, the Monroe Carroll Jr. Children's Hospital at Vanderbilt, where discovery brings hope, Vanderbilt University School of Medicine, Department of Pediatrics, Baptist Healing Trust, fostering access to compassionate health care in Middle Tennessee. Additional support provided by the Orrin H. Ingram Fund and by members of NPT. Thank you.
Hi, I'm Kimberly Williams-Paisley. If what we're doing now isn't improving our children's health, then what can we do as parents, as healthcare providers, and as a community to ensure our children will have their best shot at a long and healthy life? Join me for this edition of NPT Reports Children's Health Crisis as we explore a broader picture of health that goes beyond healthcare. Stay tuned.
My first experience when I had to take Jordan to the emergency room with an asthma attack, you could tell he was struggling and he started to sweat really, really bad. I had called the pediatrician and she had told me to just go to the hospital. We got back in the room and they started putting all this tape and wires on it, and I'm like, oh my goodness, what's going on? Looking at a child that young, they can't talk, they can't tell you what's going on, what hurts. As a parent, it hurts really, really bad because it's nothing you can do. You don't know where to hold them, where to rub, what needs fixing, and it's just a guessing game. And when you get to the hospital, it's the same way. You're helpless, just like the child. You don't know what to do.
Yeah, she's pretty tight, Mom.
In the last 25 years, childhood asthma, like obesity and diabetes, is on the rise in the United States.
And right here, that means that their lungs are pretty clamped down and tight.
Today, asthma is the most common chronic disease in children, a leading reason children are absent from school, and the most common cause for hospitalization in children.
Now listen right here. Good job.
Asthma is primarily an inherited and environmental disease.
Perfect.
We cannot prevent a child from getting asthma.
Here we go.
We'll never be able to prevent all acute asthma attacks, and that's one of the reasons we are here as an emergency department.
There, good girl.
But we think we could probably prevent about 90% of the visits to emergency departments by good preventive care.